I'm Micheline Chu with Reproductive Medicine Associates of New Jersey. I grew up in Bergen County, New Jersey. I went to Harvard College and then Harvard Medical School. I did my residency in Obstetrics and Gynecology at Yale and my fellowship in Reproductive Endocrine and Infertility at Columbia. Since I finished fellowship, I've been at, now called Northwell, but North Shore, Long Island Jewish Health Systems. I always liked the sciences, so I did major in the sciences in college, and then my thesis advisors in college were in medicine, and they were amazing women. I get tons of baby announcements and Christmas cards. Actually, that's the highlight of my coming to work is the mail and seeing the photos from patients, and they all keep in touch, and it's nice to watch their kids grow up through the years. I think a lot of people are hesitant to consider going to a fertility specialist because they're worried, does that mean I have to do IVF? That's not what I thought when I went about starting to have a family. We've done all the fertility testing, there's nothing physically wrong. Then it's a matter of reassuring them it's not a bad thing that I can't find something wrong. It actually means there's nothing wrong, and so we build upon that. A lot of times what makes a patient get a diagnosis of this PCOS, polycystic ovary syndrome, is that they don't ovulate. So if they're trying to conceive but they're not ovulating, then time is passing and they may or may not realize that what could be a year of trying is maybe only a couple months. Maybe they've only ovulated a couple times during that whole year. It's nice to help because there is something I can actually do to move things along in not a very aggressive way. For example, somebody who's had 3 or 4 miscarriages, they're starting to lose hope, almost afraid to get pregnant again because it might end in another miscarriage, and then to help support them through another pregnancy, perhaps using the technologies that we now have that didn't even exist 30 years ago, and then once they have that child, visiting them in the hospital, and it's just amazing that you're a part of all of this. Well, it's known that RMA has the highest success rates in IVF, and then a lot of the initial studies in terms of the pre-implantation genetic screening, biopsying embryos, checking their genetics prior to putting the embryo in, started here. Having seen a lot of very close friends go through a lot of different situations, I have some insight. It kind of helps when you can, be familiar with the situation. I've been doing this for a long time, which is helpful too. And most people want to talk and just have you listen. And then I think for me, that's probably the easiest way to get to know them. Is patients have a choice of a lot of practices. There's tons of practices in every geographic area. I think number one is to feel comfortable with whichever physician they've chosen, that they feel that they can trust that physician to help guide them in their care and do the right thing by them. And also, I always encourage physicians to check online to look at the success rates for each program. I think that the complementary alternative medicines do play a role. For some patients, more than for others. That's the rewarding aspect of it, being able to make the phone call and saying, "Hi, it's Dr. Chu, good news, your test is positive." That there's nothing like that.